Welcome to Healthcare Hour with Dr. Chikwendu Ejike, the Chief Surgeon at Galaxy British Hospital, a specialist on oral, maxillofacial, and the cleft surgeon.
My name is Dr. Chikwendu Ejike Kajeta. I'm a consultant maxillofacial surgeon and a certified smile trained surgeon. I'm the immediate past head of Department of Dental and Oral Maxillofacial Surgery, Federal University Teaching Hospital, Owerri. I was also a one-time head of department and examination officer, Madonna University Teaching Hospital, LL Campo, River State, from the year 2016 to 2020, before I resigned for personal reasons. I'm also a senior lecturer in Department of Dental Technology, Federal University of Technology, Owerri, Futo. I'm also the MD, Galaxy British Hospital, which is a multi-specialist hospital, which we are now, Owerri, and also the MD of Galaxy Dental Hospital Clinic, Awodra Road, Owerri. I'm a fellow of the National Postgraduate Medical College of Surgeons in Oral Maxillofacial Surgery, associate fellow of West Africa College of Surgeons. I'm also a fellow of the Institute of Management Consultants. I'm also a fellow of the Institute of Management Specialists. I'm also a fellow of the Institute of Cooperative Affairs.
A little breakdown of maxillofacial surgeons. These are medical doctors that specialize on mouth, jaw, face, skull, and the associate organs. In addition to that, they can also act as dentists. To the breakdown of cleft surgeons, these are doctors that deals on gap or split in the upper lips and the roof of the mouth. In a nutshell, this doctor here, Dr. Chikwendu Ejike, is a specialist on both maxillofacial and the cleft surgery, with both national and international training experiences. He is also the owner of Galaxy British Hospital, Owerri. The hospital is 2 minutes away from Owerri Sports Center, Imo State. They have multiple branches though. Dr. Chikwendu has been in partnership with SMILE for over 10 decades now, which has given him multiple privileges to travel to many countries of the world, fully sponsored by SMILE. On top of that, his partnership with SMILE has given him privileges to perform multiple successful surgeries freely to people who could not afford the bills, fully sponsored by SMILE, thereby giving him more great privilege to bring significant value in the society through his enormous service to humanity. Life is highly valued when service and the significance values are on the limelight. The first time I heard of them, I couldn't believe it at all. I told myself, this is one of the scammer schemes, either to extort people or to drive customers to their hospital, thereby fronting 100% free surgery, even with this height of economic crisis in Nigeria. But as a journalist, we don't conclude things based on our personal assumption, feelings, or based on people's opinion, but based on proper research or investigation. So for that reason, I called the phone number on the flyer I saw and then spoke with the chief surgeon for the first time. He sounded cool and highly convincing, but still I wasn't convinced yet. He then invited me to his hospital, which I accepted the invitation. But due to my busy schedules, it took me 3 good months to finally visit the hospital in person, and trust me, it was a very wonderful experience. However, even when I've seen that both the hospital and the chief surgeon are real, I still had one more doubt left, which is the phrase of 100% free surgery. So I kept my intuition active and continued observing everything going on there, and in the end, they cleared all my doubts. They actually offer 100% free cleft surgery on both infants, kids, adults, and even with the very aged people. On top of that, they do train doctors on cleft and the maxillofacial surgery freely and fully sponsored by SMILE.
Because for a woman like you to see this flyer and you were asking yourself, could this be real? And I'm happy that your coming coincided when I had such surgeries are what I'm doing. Every week I do about 7. Every month I do about 7. So every week I do about 1 or 2 what? Cleft. So for you to see this flyer and trust me to this place, you are a Smile Trend ambassador. If Smile Trend sees this video, they're going to be so proud of you. So please, I'm going to plead on behalf of Smile Trend that the only thing you could do to us is to carry this goodwill message to other people. The downtrodden, the ones in the village, in the urban areas. It cuts across all ages. It's not only children. If you see a woman at the age of 90 with cleft lip and cleft palate, bring the word woman. If after assessment the woman is fit for surgery, I operate the woman also at free of what? Charge. As long as Smile Trend is what is concerned. So Smile Trend is not restricted or limited to any what age, what group. As long as I was cleft lip and cleft palate, bring to a Smile Trend partner and we'll get the surgery work done.
In as much as they offer free 100% surgery, that doesn't mean that when a governor, senator, ministers, commissioners, or wealthy individuals come for such surgeries that they won't foot up their surgery bills. No, not at all. Also, that doesn't mean that an individuals, organizations, or groups can't partner with them according to their strengths. Actually, Smile do foot up the entire surgery 100%, but they don't foot up the entire existence of the hospital, like the staff salaries, hospital equipment and its repelling, taxes, NEPA and diesel bills, and so many other bills involved in managing a healthcare institution. All through my stay in that hospital, there was never a moment of power outage because once NEPA take light, they switch over to the big generator within a few seconds. So there are at least 24 hours power supply in their hospital 24/7. The hospital is highly equipped with powerful facilities and the hospital equipment. In fact, if you enter there, you would think the hospital is owned by a British organization. At some point, in curiosity, I kept asking the doctor if he is actually the owner due to his level of humility, both on phone and in the physical. More so, based on the level of investment I observed there.
You know, I just put my last picture. If you want the baby is already fighting us. The baby is fully awake. That's why Dr. Humble, which was the anesthetics, was telling you that, you can see the child is crying, that the gas we are using is the most expensive in the world and the safest in the world, called was several what? Fluorine. So when I'm operating here in this hospital, we use several. We don't look at how expensive it is. Remember that this surgery is fully organized and sponsored by Smile Trend. And patient get it at free of what? Charge.
So are you saying that the child's parent didn't pay?
They didn't pay a dime. The child parent will be interviewed when I'm done. They didn't pay a dime, they will not pay what a dime. Rather, there's a small money given to me from Smile Trend. Today I've given each parent 5,000, am I right? True. As their transport was fair and they were feeding. No matter how small it is.
At this point, a lot of people will be asking questions like, what is Smile? Is it a tech company, financial institution? Who are the brains behind it? Is it a private institution, corporate organization, NGO owned by Nigerian? Or is it an American-based organization that has spread its branches across the globe? Now let's get the answer to the above questions from one of their partners here in Nigeria.
You can't talk about clefts, orofacial cleft, be it cleft lip and cleft palate, without talking about what? Smile Trend. Smile Trend is an NGO based in the United States of America. Smile Trend is the leader when it comes to orofacial clefts. Others are just trying to catch up, and I don't think they will catch up. Smile Trend solely sponsors cleft lip and cleft palate surgery, from card fee, theater fee, anesthetic fee, drugs, until patient is discharged at no expense. So, for example, this year I've done over 100 cases. And all these 100 cases, from their card to surgery to drugs to discharge, everything is free of charge. I thank God you're in the theater while I just did one cleft palate surgery now. Yeah. And you're able to interview the parents of this child, who told you that they've not paid what? A dime. Smile Train also offers grants in terms of help to these patients who are needy, and also those that are coming from a long distance that require stipends for their transport fare. So may it suffice it to know that the book I'm about to bring now is the book for Smile Train grants, Smile Train Express grants for Galaxy British Hospital, Owerri. So this book, if I open inside, you find out what designated inside are patients who came, Smile Train patients that came and didn't have money, and grants given to them in terms of what? Transport what? Fare. This is where they were assigned.
This child here is one of the beneficiaries of Smile 100% free surgery. He is an orphan, but these two amazing souls here are now his foster parents. This is actually the kind of people Smile's offer is meant for, not for wealthy individuals or someone who can afford to foot up his bills. They are likely to be people with excruciating history. This is more reason it would be great if individuals, governments, or organizations donate or partner with them regardless of Smile partnership or contributions with them.
The situation surrounding Chikwendu's birth and the death of his parents, I don't think I should, as a person, I don't know, it would be very inhuman for me to, see him and turn my back on him. And he was just a kid, and from the day he was born.
It is highly disheartening hearing the story of this child. I felt goosebumps all over my skin, seeing the true affection shown to the little boy by his foster father. The first time I entered their corner, I wanted to capture the child, but I couldn't because he was sleeping. So I waited for some time to see if he could wake up, but later decided to film him and his foster father while they were sleeping. Honestly, if you see the way the guy cuddled this child, even though he wasn't aware that somebody was filming him while they were sleeping, then you wouldn't hesitate to join me to call such an act of true and unconditional love from a very young man who is not married yet and has never fathered any child before. I focus my attention more on the guy's behavior because larger population of men locally and globally have little or no time for children, both married and unmarried ones. Women are generally known to have greater bonds with children, whether biologically or non-biological children. My special request from anyone watching this presentation, both the foster father and his fiancée are into event planning and event decoration. Patronizing their business will be a great contribution to the child's well-being. Imagine a little child of such age already facing multiple challenges of life, which even some people who are in their late 20s and the late 50s have not encountered such suffering before. He lost his parents at age 3, undergone cleft surgery at age 4, and is currently suffering of partial sight impairment in one of his eyes. In addition to that, patronizing their business or giving them any kind of financial help will be a great way of promoting unconditional love in the society and also inculcating among youths the ability to love beyond romantic love, especially on male genders. A lot of people have wrongly defined love today, thereby projecting sexual intercourse as love, but in the reality, it is not true. My experience in the theater room. I don't know if it is going to be hyperbole to say that after God, it is doctors, nurses, and the entire people in the health care. But nevertheless, every profession is as important as others because without the farmers, the doctors cannot survive. Without the teachers, doctors can't be trained. Without the pilots and the engineers, doctors would only travel outside their countries or other continents by leg or by car, thereby spending hundreds of days wandering in the deserts to get to their destinations. However, without we in the field of journalism, who would report the amazing work of these amazing doctors, nurses, pharmacists, and so many other great examples that time may not permit me to mention one by one. But on the other hand, people in the healthcare should be included among professions that need extra care and support, especially financial support in the society. Imagine standing and watching human jaw completely evacuated from his body, worked on it, and then fixed it back. Isn't that wonderful? Igbos Nweremade. This doctor is among the great potential people Igbos have. At some point, I felt like to disappear completely from the theater room due to how scary it was watching some parts of human body being pieced and stitched back seamlessly afterwards. But for the fact that I wouldn't want to bring an inconclusive story or a presentation that would have a fiction look, whereby I am not telling a fictional or fairy tale story. Note that this is my first time ever in the theater room in my whole life. On top of that, I am allergic to certain images, substances, or some health conditions. But I had to comport myself, pretending as if all is well, whereas I was slowly and literally melting inside. Upon that, I continued filming the whole exercise, and I tried my very best not to miss anything. Finally, kudos and the better life ahead to all the medical practitioners in the whole world, especially for those who truly place saving lives and the humanity on the highest value. My special thanks goes to the second doctor that participated in this surgery. I don't know his name. Also, my special thanks goes to Dr. Chikwendu Ejike, the Chief Medical Consultant, Galaxy British Hospital, for his high level of humane, unconditional love for everyone and for his humility. He is a paradigm of life of full contentment, trustworthy, humbleness to the core, and a significant value provider to humanity at large. You can also participate in this humanitarian work in whichever way you think is most convenient for you.
I'm Dr. Humble Evichi, anesthesiologist. Okay, one, I feel very relaxed working with Dr. Ejike because one was able to do the minimum requirements. So this one will give us safe anesthesia. The machine he has is not only about 3 or 4 hospitals in the world that has anesthesia workup machine. Now for a patient that's going to be under anesthesia for 4 or 5 hours, you don't have to keep on bagging for that 4 or 5 hours.
Okay.
You just intubate the patient, put the patient, relax the patient, and connect to the machine. Machine breathes for you.
Do you intend to have that kind of partnership with the doctor?
Yes, I intend to. An example is like in Ejike Hospital. The first people that started that hospital, they are no longer alive. But Ejike is still wasting strong because of the partnership, strong bonding agreements. I also have a hospital. In fact, my own has up to 40 doctors from FMC. The same thing we do here.
Okay, but you see a partner with him, even though you have your own hospital?
We are a team of anesthetists.
Wow.
Understand? Me and my Oga, Dr. Han, we're the one that come here to anesthetists. With other anesthetists coming here.
Okay, but do you believe Nigerians, especially Igbos, we don't believe in partnership? We do say it with our mouth, but we don't act it.
We cannot succeed without partnership. We cannot succeed in Igbo land, in any business, without partnership. Partnership will give you more robust knowledge. Partnership will give you more financial muscle. Partnership will give you, like they say, 2 good heads are better than 1. You see good ideas coming from partnership. You understand? Then the problem is that sometimes partnership, you need to have a very uniform agreement. Things should be separated down so there won't be anarchy. Because I learned in the previous doctor's partner, but along the line, they separated because of maybe accountability problems, embezzlement, I don't know. But the kind of partnership I want to have is that even when I'm making negotiations, all the partners will partake in what is happening. Science has made it clear for you to have a very clean partnership protocols that everybody understands.
How do you feel to be a nurse?
I'm so happy, so excited, like walking, see my patients recover from any kind of sickness they came with, and also the surgery. Like there is this joy in our hearts when we finish surgeries and the patient is okay. Patients will go home with excitement.
Okay, finally, how do you feel to be working with Dr.
Fantastic. Like he's a nice man. Like so far so good. He's somebody that if you do any mistake, he will correct you with this hand by maybe doing anything that will touch your heart. Later he will now use the other hand to come and call you as his own sister, as his brother. Like he play with everybody here, both the patients, both the staff. So he don't take anybody maybe because you are this, you are that. He will not say no. He take everybody as equal.
The humans don't reason like AI, and AI can't replace humanity. Medical field is all about humanity, and AI doesn't have humanity. So that is the difference between AI taking the jobs from people. But for medicine, there's no scare about AI. AI is welcome to join us. It's a welcome development in the field of medicine. I am Nurse Prince and I work with.
Thanks for watching. I am Ejike for Scrum Television. Do subscribe and follow us on our channels on all the platforms: LinkedIn, Facebook, Instagram, Twitter, YouTube, and all that. Or you can log on to www.scrumtelevision.com.